Good afternoon. I'm Rachel Fishlock, a proud descendant of the Yuin Nation and the CEO of Gayadui Proud Spirit Australia. Before we commence, I'd like to acknowledge the traditional owners of the lands we're on today. I'm here on the lands of the Ngunnawal and Ngambri people, and I'd like to pay respects to elders past, present and emerging. I'd also like to acknowledge Aboriginal and Torres Strait Islander people who have joined us online today, as well as those with lived or living experience of suicide. Without their stories, we wouldn't be able to write policies, develop frameworks, or deliver services as we strive towards zero suicide. We're excited to work with the National Centre for Aboriginal and Torres Strait Islander Health and Wellbeing at the Australian National University to bring you this webinar. Without further ado, I'm delighted to introduce you to Dr. Bronwyn Wilkes and Thurber, who explore the profound impacts of the Voice to Parliament referendum on the health and wellbeing of our communities.
Yuma, hello everyone. My name's Bronwyn. I belong to Gundungurramob from the Burragurang Valley in Western Sydney, and today I'm speaking to you from Ngunnawal country. So I'd like to acknowledge all the country that supports us to meet today, and offer my respects to elders, ancestors and knowledge holders who've cared for country and kept culture strong since time immemorial. And I also want to acknowledge all the mob tuning in to listen, and to all of our elders and ancestors from whom we draw strength. Thanks very much to Gayadui for hosting this webinar series and for inviting us to be part of it. I'm here today with my colleague Katie Thurber on behalf of the team whose names you can see on screen. We're going to tell you about some of the work this team has been doing over the past year or so on monitoring mental health and wellbeing for mob over the referendum period and beyond. And this is a team that's led by Professor Ray Lovett at the National Centre for Aboriginal and Torres Strait Islander Wellbeing Research. Our centre is based at the ANU on Ngunnawal country, and we've recently been honoured with being gifted the name Yadura Walani by Ngunnawal elders. Yadura Walani means strong, healthy place, which reflects the goal of the work that we do across the different teams within the centre. Our research group is one of these teams within the centre, and we focus on links between culture and wellbeing. We're a First Nations-led, First Nations majority research team. We predominantly do epidemiology research based on community-identified priorities, and often this is in partnership with communities and community organisations with the aim of promoting health and wellbeing through strengths-based approaches. So not just looking at what's wrong, but focusing on what works to keep us healthy and strong. Given the nature of the referendum, today's presentation has a fair bit of focus on what's wrong in terms of racism and discrimination. So some of the data that we'll be presenting today can be a bit difficult to hear. It concerns racism, discrimination, psychological distress. So if anyone needs to step out at any point to take a breather or attend to self-care, please don't hesitate to do that. I'm sure many of you will be familiar with 13 Yarn and the various support services and the self-care resources available, but we've got phone numbers and some QR codes on screen to help you connect with those quickly if you need to. The project that we're talking about today has a couple of different parts, and I'd like to hand over to Katie now to tell you about the first part of the project.
Thanks, Bron. I'll just also acknowledge we're here on Ngunnawal country, so I'd like to pay my respects to elders past and present, and also acknowledge all the country where you are joining us today. So my name's Katie Thurber. I'm a non-Indigenous researcher. I was born in the United States. I've been working on Ngunnawal and Ngambri country since 2011. I've been working with the Marquai study team since 2016. So as Bron said, there's two parts to this project, so I'll be speaking to the first part. And the aims were to identify key concerns and services that were required in the lead up to the Voice to Parliament referendum. And the second part was to monitor levels health and wellbeing in that lead up period and now beyond. So the first part, we held focus groups. So we yarned with people across 6 locations to identify what people were worried about and what they thought would help during this time. So we worked with 84 participants. We had a group of elders, we had a group of youth, and we also had men and women across these groups. So we held the focus groups in Warramai, Newcastle, Melbourne, Canberra, Perth, and Thursday Island. I'd really like to thank all the participants who shared with us very openly and honestly during a time that was very difficult, and without their input we couldn't have done the work that we did. So their advice that they shared with us helped inform what supports could be put in place in the lead up to the referendum and following. The second part of this project is monitoring wellbeing in the lead up to, during and beyond the referendum. So Bron will speak to this part, and for this part we're analysing micro-eye study data. So through the focus groups there were 7 key themes that arose and that were spoken to in each of the groups. So the first and overarching theme that we identified was that the referendum was adding one more form of stress. It was one more thing being added to the load that people were already carrying. People felt that life was already full of stress, as we all know, and that this was just one additional thing that was brought in from the outside, adding stress to people's lives. People spoke about uncertainty with respect to what the referendum meant, what was going to happen in terms of the vote, but also what was going to happen afterwards. People, even in the lead up, were wondering what would happen, whether it was a yes or a no. There was sort of pre-anxiety about what might happen. A huge theme that came out was the mental load, that the referendum and conversations around the referendum were adding this additional load on people, that it was a cultural loading that all non-Indigenous people, whether colleagues, friends, students, and any people at the gym, would look to you, to look to Mob to answer their questions, to tell them all about the referendum, expecting people to know and also expecting them to be able to tell and to share. We had participants saying that just because I identify proudly, it's not my job to tell other people. It's not my job to inform anyone. It's my choice. Racism was a key theme that came up. People felt like the referendum conversations had emboldened non-Indigenous people to say what they wanted, given that the conversation was around the fact that at the current time Aboriginal people did not have a voice, that they were reinforcing that message and taking all the voice for themselves. People talked about increases in experiences of racism in their everyday life, being worried about leaving the house, being worried about their kids and the experiences that they were having, and being completely bombarded by these experiences in the media and beyond. People were really concerned about division and conflict within the Aboriginal and Torres Strait Islander community, within families. So we know that there's diversity of views within families, within communities, obviously across the nation, and these views were, in some instances, tearing families apart, tearing communities apart. And this was the primary concern, in addition to the division that was obviously happening between the non-Indigenous community and the Aboriginal and Torres Strait Islander community. There was a lot of worry about this and what the long-lasting impacts would be. People also spoke about this process and these conversations being a threat to their own identity. So people feeling that they have a right to debate Aboriginal and Torres Strait Islander people's rights and lives, that it was putting Aboriginal and Torres Strait Islander people on display and having them be open conversation for people throughout this time in a completely ongoing and overwhelming way. There were also serious concerns about re-traumatising through this process. So when people were talking about this referendum, it was bringing people back to, for example, the 1967 referendum, for those who had been around for that. It's brought people through past experiences of trauma, and it's brought people into feeling or being asked to walk people through history in a way that continues to traumatise and re-traumatise Aboriginal and Torres Strait Islander people. And with the feeling that non-Indigenous people did not understand the load that they were putting on people. They didn't understand what position they were putting people in through this. Through the focus groups, we heard a lot of fantastic ideas about things that would help. So these were ideas that came from the participants, and acknowledging that what they saw was that services were already overburdened before we had this extra load. Services, particularly ACHOs, were already at capacity. So there wasn't, at baseline, there wasn't enough staffing or time to really address all of the concerns that people had. People saw that there was a need for more than crisis care, so more help to help prevent things from getting worse, not waiting till people are already at the pointy end, already at real risk, to be able to have somewhere to go. There was a need identified for somewhere for people to go early to keep health and well-being. People talked about how health services were often not quite the right fit, that often they needed somewhere that they could have full attention to social and emotional well-being, and also a broader, more holistic look at how they were going, and a lot of importance of thinking about how culture and family and community could all be supported and encouraged through this time. People really voiced a need for flexible options, that some people might not be able to attend in person, they might not want to have their identity known, they might need to be confidential, they might prefer to speak at different times in different ways, and having to book in and get into a clinic was not necessarily the path that worked for everybody. People spoke to the importance of relationality, to building that relationship with whoever it was, a counsellor or other that they were speaking to, that a series of one-off appointments or one-off conversations wasn't going to provide adequate support, and in fact could actually cause more stress and more trauma to people. People, again, referring back to the holistic supports that people were asking for, they wanted safe spaces to connect with community and culture to help keep their well-being strong. So from what we heard, we put together fact sheets that went out. They were tailored. One fact sheet we put together for a mob that outlined some of the supports that had been put together during that time. We also had fact sheets for non-Indigenous people that were focused around how not to add to the load for Aboriginal and Torres Strait Islander people. We have fact sheets for organisations and things like that. All of these fact sheets are available online if people are interested. We've got the link below. So I'll hand over to Bron here to speak to the quantitative analysis.
Thanks very much, Katie. So for this second part of the analysis, the quantitative component, we used data from the My Kauai study, which is a nationwide longitudinal survey of Aboriginal and Torres Strait Islander people that our team has been running for many years, and started collecting data in 2018. And the survey collects data on a broad range of variables that have a bearing on health and culture. But for this analysis, we focused on a handful of variables related to exposure to discrimination and racism, to mental health and social and emotional well-being, as well as some general health, family and well-being, self-determination measures, and some health service use variables. And we compared the prevalence of these various outcomes and exposures across 3 time periods. The referendum period, which was from February last year when the formal campaigning kicked off, up until the day of the vote. So we had just under 1,300 people in that sample. And then we compared the prevalence in that period to 2 previous periods. So the year immediately before the referendum period, which we're calling the pre-referendum period, and this was before public discussion around the referendum really ramped up. And there are over 2,000 people in that sample. And we also had a baseline period which included almost 10,000 Aboriginal and Torres Strait Islander adults, so 18 years and over, for all of these samples from our first wave of My Kauai data collection in that baseline period. That's spanning mid-2018 to mid-2021. We're also in the process of continuing this analysis to look at what has been happening post-referendum, but we haven't finished that yet. So today what we're talking about is just those first 3 periods. So it was a cross-sectional analysis where we looked at the prevalence of the outcomes among the people in each of these 3 time periods, and then we used data from the census to weight those estimates from our cohort to get a better estimate of how prevalent these things are in the total population of Aboriginal and Torres Strait Islander adults. So these graphs here and on the next couple of slides, they're all weighted prevalence values on the vertical axis. So the percentage of the total Aboriginal and Torres Strait Islander adult population who experienced the variables listed along the bottom axis across each of these time periods. So for each variable, there are typically 3 columns. So baseline in purple on the left, then the pre-referendum in blue in the middle, and the referendum period in green on the right. For the vicarious racism measure, you'll see there's only 2 columns there, and that's because those questions weren't available in the Wave 1 questionnaire. They were only introduced into Wave 2, so there's no baseline data for that. But for each of the variables, we tested for significant differences between the referendum period against each of the previous 2 periods. So an asterisk means that there was a significant difference from baseline, and that hash symbol means there was a significant difference from the pre-referendum period. So here over on the left, you can see that the percentage of adults who experienced any everyday discrimination increased compared to both of the previous periods. So during the referendum period, it was about 7 percentage points higher than it was at baseline. Healthcare discrimination also increased. It was about 6 percentage points higher than it was at baseline. And then over on the right-hand side, we have a measure of vicarious racism that includes experiences of hearing jokes or insulting comments about Aboriginal and Torres Strait Islander peoples, and witnessing unfair treatment of Aboriginal and Torres Strait Islander people. And overall, we didn't see a change in this compared to the pre-referendum period, but you can see that it's very high. It's around 70% of people reporting that they experience these kind of things. So the nutshell message here is that discrimination and racism are pervasive. Discrimination is increasing for many people, both in everyday settings and in healthcare settings. And these results are consistent with what focus group participants told us was already happening, and also with many of our lived experiences over this period. And so given that we're seeing discrimination increasing, it's not surprising that we also saw some change in some aspects of mental health or ways of coping with that increase in discrimination. So here you can see that the prevalence of high to very high psychological distress increased. This was about 3 percentage points higher in the referendum period than it was at baseline. We also saw a small increase in risky alcohol consumption compared with the immediately previous pre-referendum period, but this wasn't different from the baseline period. And this small increase might reflect alcohol consumption being used as a coping strategy in response to the increased stress and discrimination, which is something that some of the focus group participants mentioned, and which is why we included this variable in our analysis. We didn't see any change in PTSD or depression. We saw a decrease in the prevalence of doctor-diagnosed anxiety. And we should note here that these measures are for doctor-diagnosed anxiety and depression, so there'll be a time lag between any change in the experiences that's in the community and then seeing them in our numbers. But the psychological distress measure is a much more immediate and timely measure of how people are going, and that's the one that we did see increase. Some other measures that give a more immediate picture are these general wellbeing measures, so good general health, high happiness, and high life satisfaction. And you can see that these are all still fairly high, with the majority of adults reporting having good general health or high levels of happiness or life satisfaction. But we are seeing significant decreases in all 3, and notably an over 12 percentage point drop in good general health. And so while the analysis that we did doesn't allow us to draw any conclusions about causation, it's not that surprising that we're seeing decreased general health and happiness at the same time as increased discrimination. When we look at measures that contribute to good health and happiness and life satisfaction, such as these measures of family support, you can also see that they've generally moved downwards across the board. So these are things like people's sense of their family always being there for each other, their family getting on and coping in the hard times, accepting for people for who they are, things internal to the family, but also in people's sense that their family has good support from mob, or that they feel like they belong in the community. Again, for many of these, we're still seeing high levels, a majority of people saying they have strong family support for a lot of these, which really speaks to the strength and resilience of mob. But it is really worrying that we're seeing substantial decreases in these important aspects of support over the last few years. And again, this was something that came up as a concern in focus groups, as Katie mentioned earlier. Looking at some measures of self-determination, we're seeing some declines in people feeling in control of their life or being able to get involved in community discussions. We're also seeing that fewer people think that the government has the final say in decisions about their community, and this might indicate that rather than the government, it's the non-Indigenous voting public that's seen as having the say in those decisions. We also looked at some cultural connectedness measures, and here we see what seems to be a good news story, that a smaller percentage of people are feeling disconnected from culture, or to flip that, a greater proportion are feeling connected to culture. And hopefully that's something that can be built upon to support wellbeing going forward, and it'll be interesting to see if there's any change in that in the post-referendum sample. Encouragingly, we're also seeing high levels of participation in social events related to Aboriginal and Torres Strait Islander people, which are important for sense of community. And just finally, we looked at some service use measures. The main changes we saw here were an increase in uptake of the 715 comprehensive health check, which could reflect a number of factors, so it's difficult to interpret that in isolation. And we're not seeing any change in high healthcare use or in mental health first aid training. So just to summarise those changes that we've observed, we're essentially seeing increases in stressors at the same time as decreases in some of the protective factors that help buffer against those stressors. And this is starting to be seen in declines in wellbeing outcomes. So we are still seeing relatively high levels of wellbeing despite this high burden of discrimination and psychological distress. And it's likely that these high levels of wellbeing are underpinned by the high levels of family and community support and the strong connection to culture that we saw. But it is concerning to see that many of those sources of family and community support are being eroded at the same time as discrimination and racism are increasing. So there's a clear need for more culturally safe support services across the spectrum, not just clinical treatment, but programs to bolster family and community wellbeing and connection to culture and country. As Katie mentioned, a key thing that focus group participants spoke about was the need for preventative care, so not just crisis care. And this included having safe spaces to connect with community and culture and country, so holistic cultural programs that are not just about individuals, but also families and communities. At the same time, we also need elevated efforts to eliminate racism and discrimination. This needs to happen everywhere, including in healthcare settings, so that all mob have access to culturally safe healthcare and they don't have to carry this additional burden of racism and discrimination. And action by non-Indigenous people and organisations is really imperative here. One of the things that our team has been working on is some tools to help encourage action in that area, and so the QR code on screen here will take you to those resources. So if any of these are of use in any of the advocacy work that you do, please feel free to forward them on to anyone who may be interested. As I mentioned earlier, this research is ongoing. We're in the process of analysing the first post-referendum sample, and we plan to continue that over the next year or so, out to 18 months post-referendum. So, yeah, this is research that's been funded by the Department of Health and Aged Care, and we've been speaking with the department about the results along the way and what they mean and what we can do about them throughout the project. So we'll continue to be doing that. If anyone has any questions, feel free to email us. Our addresses are on screen. The QR code over on the left will take you to our project page where you'll find fact sheets and summary reports. But feel free to reach out if you have any questions or comments. And just before we wrap up, I've just bombarded you with a bunch of graphs that are pretty heavy in terms of what they represent for real people in our communities. So here are those links to a range of self-care resources again. The big one over on the right is a short meditation in language by the NPY Women's Council, which might be a nice way to ease back into your day. So thanks very much for making time for us. I hope that was useful.